All right, welcome back in this afternoon. In today's Ask the Doctor segment, we're talking about hand pain, from things like carpal tunnel syndrome to arthritis. And Dr. Elizabeth Perkins is a rheumatologist. She's at Brookwood Medical Center and also Sylacauga, right?
That's right.
You go back and forth, so she's a busy, busy girl. So what's the most common problem we talk about when it comes to the hand?
So there are numerous syndromes that cause hand pain. Probably the most common is osteoarthritis. That affects patients over the age of 40. Typically involves the distal joints of the hands. Not a whole lot you can do to help that. It's largely hereditary.
Treatable?
It is treatable. Not as easy as some of the other joints like the knees or the hips, where you can really impact the outcome through exercise and activity. But it is treatable and manageable.
Okay.
Other major causes include carpal tunnel and many of the overuse syndromes, such as trigger finger, de Quervain's tendinitis, or bursitis, and we see a lot of that in the hands.
All right, well, let's go to Joyce, who's in Verbena. She has a question today. Joyce, are you having some problems? You have a question?
Yes, ma'am, I do.
Okay, what's your question?
My question is, how is it treatable? What are the meds for that? I have been on methotrexate, the dexamethasone, meloxicam, and salsicate, and I'm getting no relief at all.
Well, thank you for that question, Joyce. It sounds like you actually have another cause of hand pain, one that rheumatology sees quite a bit, and that's rheumatoid arthritis. And that is an inflammatory arthritis, very different from some of the other causes we've talked about so far. There are numerous medications. Several choices exist out there for you. You're currently on a very good medication, methotrexate, that we use for that. But there are also medications in that same class that you can talk about with your rheumatologist. There are also biologics out there. If your rheumatoid arthritis isn't under control and you still have quite a bit of pain, it's worth talking about that with your rheumatologist.
Don't give up, in other words. Don't
That's
just
right.
Say.
That's right. There are many choices still out there for you, and you need to work through that with a rheumatologist, because we treat rheumatoid arthritis.
Okay, Joyce, you heard of that. You tell your doctor. She said to follow up with something else.
We can take care of that.
Okay. Who's our next caller? I'm sorry. Betty is in Pelham. Hey, Betty.
Hey.
Hey, what's your question?
I have two granddaughters, 9 and 10, and they're constantly popping their fingers. Will that make them have arthritis?
So that's a common old wives' tale. It probably isn't a good idea, because you can cause other things like overuse syndromes. And so you can actually do some minor damage long-term to the tendons, but probably not going to cause arthritis.
We all grew up, though, with your mom going, quit popping your knuckles.
That's right. That's right. It's
they pop them all the time.
So it probably means that they need to be doing something else with their hands, but they're not probably going to cause a lot of damage to the bones. But you do have to think about the health of the tendons and other soft tissues in the hand, and I would discourage that.
Why does it feel better sometimes if you do pop? Is it like it releases something?
You're really giving yourself some therapy and stretching the tendons and muscles and different soft tissues in the hand.
Okay.
So.
All right. Who's our next caller? Rhonda is in Oxford. Hey, Rhonda.
Hey.
What's your question?
I work in production, and I've had the carpal tunnel, and I've had the trigger locks. But how do you distinguish between arthritis and other issues that you would have with a hand?
So if you have carpal tunnel, it's kind of like saying you've got a flat tire. There are many different causes for a flat tire, and you need to really figure out what the underlying condition is that's causing the carpal tunnel, whether it's extra muscles in the hand, whether it's something you're doing in your daily activities, or there's an underlying inflammatory condition. Prior trauma can cause that. So there's actually multiple causes of carpal tunnel, and that'd be my first suggestion, is to figure out what the actual cause is of the carpal tunnel. And if you're prone to this, or it's difficult to treat, and you've had other tendinitis in the hand, such as trigger finger, it makes you think a little bit more about searching for inflammatory conditions, something more systemic. So we have various approaches to therapy: splinting, rest, or physical therapy. But again, I think the most important thing would be to figure out the cause, and then you can treat it correctly.
Okay. All right, I hope that answers your question. I mentioned doing it, like when you pop your own hair, you stretch your own. Is that kind of, you said that's more like therapy for yourself. Is that why things like yoga and stuff maybe make you feel better? Or is that?
That's right. Well, and with most of the arthritis and disorders of the hands and wrist, stretching them and working them actually improves it. So we encourage mobility. We encourage using the joints in the hands. Just about any condition you could have, whether it's an overuse or it's an arthritis, or a crystal disease, using the hands is important. And so if we can treat it correctly and keep you moving, that's the goal.
All right. Great segment today, Dr. Elizabeth Perkins. Great to see you.
Thank you very much for having
coming in.
me. Thanks
And
for your questions.
Thank you all for calling in today.